Hi, this is Dr. Saba from Emerald Go Dental Center. I hope all of you are safe and healthy. It has been a while I have posted any video, and today I wanted to post one. I want to share with you something about posture and teeth. Now, in your wildest dreams, you would have never thought that the way the teeth are placed inside your mouth and the way they contact during function can affect your posture. Well, the truth is it does, and there is a science behind it. What keeps our posture straight and maintains the symmetry of our body overall? Well, it is the tenacity of muscles. To understand this, we have to divide the body in two equal halves. Now, if you divide your body in two equal halves, what you see here is actually the muscles beneath your skin, giving you a very symmetrical look, and also their contractions that keep your posture straight around the joints of the body. These muscles also help in keeping the two ends of the bone, which are together in one joint, in a proper position and alignment. This tenacity of muscles also helps in maintaining the equal distribution of the body weight on the joints. If due to any reason we lose this tenacity of the muscles, we can see we lose the symmetry of the body and the posture. What is happening at the level of your skeletal system is that these muscles are contracting abnormally, causing inflammation in the muscles or certain chemical changes in the muscles, which result in pain around the area, and also the wrong distribution of weight on certain joints, causing constant inflammation and detrimental effects like arthritis. Mostly people complain of stiffness of the neck, stiffness of your shoulders, back pain and knee pain. Now obviously you want to know, how do teeth affect all this? Now the upper jaw is a fixed bone in the skull, and the lower jaw is attached to this upper jaw with help of a ball and socket joint. There are multiple muscles holding this joint assembly together. These muscles also make the opening, chewing and closing movements possible. The upper teeth act like a fence, and the lower teeth contact the upper teeth and glide over them in a plane. The teeth have to contact in one single plane. In case there is any tooth that is overhanging or is beyond that plane, then that will contact first, and your muscles here, which are supposed to be neutral while closing your mouth, will contract. This contraction will lead to the misalignment of the components of your joint, and that misalignment will definitely require a compensating muscle to align something so that you can stand straight, or you can at least function properly, or you can stand. Now if that happens, for example in this joint of mine, then my compensating muscle in the neck will try to compensate it and give me a balance, and then my shoulder muscle has to go up so that I get a balance, and so on and so forth. I have explained previously the detrimental effects of this kind of compensatory adjustment. Now, it's a very simple way to check it if you have this problem. All you have to do is that you take your head back, just tilt your neck a little back, keep your finger at the tip of your chin without applying any pressure. Your lower jaw will fall back a little. Try and close your jaw. If any tooth or a set of teeth contact first, and you have to somehow jiggle your jaw to reach to a stage where maximum teeth contact, you are prone to these kind of problems in your posture. It is very common for patients to come to the practice with complaints of failing crowns, fractured fillings, breaking up of implant prosthesis. All this happens when the muscles are active abnormally and they take over what the teeth are supposed to. My receptionist is going to demonstrate certain abnormal adaptive postures. So this is a normal posture. Darshana, turn. And this is a normal posture when you see from the sides. The weight is balanced on both the feet and both the knees. The spine is straight, the neck is straight. Now let us demonstrate the abnormal ones. So if you're standing like this, what you're actually doing is, because this is easier for you to stand this way, and most of us do. So we are giving some kind of balancing on in your left leg. So your left leg is bent because this is easy to stand this way rather than straight. And if you see from the top, you will see that the neck is tilted. There is a contraction on one side. The compensating shoulder is up. So now here the posture is abnormal. The way we are standing, she's standing here, she's not keeping her legs straight. So there is pressure on her right knee. And to compensate that pressure on her right knee, she has relaxed and kept her left knee bent. We can see it very clearly that the shoulders are not straight. To compensate the pressure on the right knee, her left shoulder is tilted a bit up. And even the muscles in the hip are tilted. If she changes the same thing towards the other side, we can see the opposite things happening. Now the shoulders again are not straight. And there is constant tenderness. This becomes a habit, and therefore there is inflammation in these muscles. Constant inflammation will lead to arthritis. Can you, Darshana, just show the posture on the side? Now this is an abnormal posture when your neck is bent forward and you give more pressure on your spine, the base of your spine. Thank you, Darshana. I hope you have understood what I wanted to convey to you, and wish you all the health and all the best and a complete well-being. Keep smiling.